Hello, and thank you for joining us today to talk about how we can help our patients and families improve their oral health. I'm Dr. Anu Vijay. I'm a pediatrician and the AAP's chapter oral health advocate for Washington State. Some might find it strange to hear physicians talk about teeth and dental health. After all, we're not dentists. However, it makes a lot of sense. Primary care providers play an extremely important role in the identification and prevention of dental disease. A significant proportion of kids have already had disease by the time they get to their first dental visit. Tooth decay is the most common chronic disease of childhood, and decay is preventable. Children see us many times in childhood, providing us lots of opportunities to make a difference and do what we do best, preventing disease. We know providers who care for children worry that they can't take on yet another topic during patient visits. Today, we want to share with you how it's possible to prevent, identify, and treat dental disease in the office. Also, we want to discuss the benefits, not just to your patient, but also to your practice. I am thrilled to have two guests with me today, Dr. Beth Harvey and Madlen Caplow. They will talk about how we can successfully incorporate oral health into our practice, and we hope their perspective can help you see how it's possible for you too. Beth is a pediatrician in Olympia at South Sound Pediatrics and a past president of the Washington chapter of the AAP. She has a special interest in making MOC projects useful and improving the quality of care. Well, this last year, her clinic was able to get MOC credit in partnership with the Arcora Foundation for improving oral health. Madlen is a senior program officer at the Arcora Foundation and a lead in the Mouth Matters program, integrating oral health into medical care. Thank you both for joining me today. So Beth, please, can you tell us a little bit about what prompted you to become more involved in this work?
So I started noticing in a lot of my really impoverished patients or patients with other disparities that they were having a lot of really severe tooth decay. And I even saw some generational effects of this. Families who I had taken care of the parent and then they had a child. And then I just started seeing the severity of passing this on generation to generation. And I think I've really started thinking about just disparities in general in my practice. And I started looking into the data a little bit and then talking with Madlen, just learned about how disparate the care for dental health is for kids, and especially the differences between kids who are on Medicaid versus kids who have private insurance.
So can you talk a little bit about what barriers you face in implementing oral health preventative services? For example, were there concerns expressed by your partners in the practice or by patients and families?
I think originally some barriers in the practice were people just sort of thought, oh my goodness, isn't this the dentist's responsibility? Why is this our responsibility? And can we implement one more change in our practice? We're doing so much right now that's just rapidly implementing new things. Is it going to be very difficult? Is it going to take a lot of time? Is this really necessary? Are we going to lose money? And also, do we have the staff time? I think those were the biggest concerns in the beginning.
Well, so how did you end up making it work? How did you implement it in the clinic, and how does clinic work now?
So thankfully, I had been connected to Madlen and the Arcora Foundation because they have a lot of experience, and obviously there are other practices that they've worked with that have done this. So we were able, I think, to reassure the staff a little bit about it not being too difficult to actually implement and the value of it. The parent concern initially was something we were a little worried about because we do live in a non-fluoridated water community with people who are very worried about fluoride sometimes. But we really approached it like we approach vaccines. It's like, you may be hesitant, but I'll give you education and give you a strong recommendation that this is a really good idea and here's why. And that seemed to really help.
Well, Madeline, can you tell us a little bit about a program, the training program for primary care providers?
I sure can. I'm going to share some slides with us. Just give me a minute here. So thank you, Beth and Anu, for sharing that information. And I just wanted to talk to you about some of the resources that the Arcora Foundation has to share with medical practices across the state of Washington. We are very fortunate in our state to have significant reimbursement and support for this work. So as talked about, tooth decay is the most common chronic condition of childhood, and it is nearly completely preventable. And it's really best if we address this issue by having medical providers, dentists, and families work together in order to address this disease. So the Arcora Foundation works across the state of Washington to help bend the arc of oral health towards equity, as Beth talked about in her conversation, that oral health, unfortunately, is one of those things that does not affect all of us equally, and people of color do tend to experience it at greater rates. That is not to say that all people don't experience decay. So we really need to address it in all of our children. And Mouth Matters is this particular program where we work with medical practices such as yours to help support them in successfully integrating the oral health services. And so what this looks like is that we work with your team to really in a tailored way to help set up the practice to be successful. So whether that is adding things to your electronic medical record, working with your billing people, and providing ongoing support in addition to the training to really help you be successful. We work with your team before the training, and then we provide a training which is free of charge, and then we follow up and are there and available to help address barriers and issues that come along. We recognize that a change of practice is always difficult, and so it really requires support and help. And we have a lot of tools to help you with that. On our website, we have a lot of resources that we can share with you to support the work that you're going to be doing. And in addition, as mentioned, there is a reimbursement that is available in Washington State. So practices must be trained by the Arcora Foundation. They must receive our training, and then they are able to bill MCOs and commercial carriers for these services. As you can see, it's a fairly significant reimbursement for a couple minutes of work with your patients. And I will say that much of the significant work of this is addressing nutrition and oral hygiene, which are things that are already a part of the Well Child visit. In addition, our support includes some resources. This is a handbook that we have created, a laminated flip book, and we have made it online as well. So that is available free of charge to all practices in the state. We also have available data to help build the case in your community. So we have some geographic specific data that you can use to look at the oral health needs in your particular community that can be found at the Arcora Foundation website. And finally, referral to dental is very important. And so we have two important resources, both the Access to Baby and Child Dentistry program, which there's a coordinator in every county in the state of Washington, as well as Dentist Link, which is online and provides referral resources for all children and adults, regardless of insurance status.
Great. Thank you for that information, Madlen. And all of this information is available on the Arcora Foundation website and also available on the Washington Chapter AAP website under the oral health section. So you'll be able to access that in many ways. Beth, now I want to kind of get a little bit into the nuts and bolts of how this works in the clinic itself. So can you tell me, when a patient comes in, what exactly is your flow for the education piece, the prevention piece, the varnish piece? How do you make that work in the clinic?
So first we had to figure out the workflow for trying to standardize it. So we decided to build little kits with all of the equipment that we might need and have them placed in every room. So the MA, as they check people in, if they're at the right age to get their services done, they put the kit on the counter to prompt us to do it and order the task. So it gives us multiple ways of being like, hey, don't forget to do the dental. And then basically what we've tried to do is link it to certain ages where you might be having conversations that would link into oral health. So whether it's bringing up how to introduce foods or teething, maternal, postpartum health, and then, you know, as we do the reach out and read, we kind of talk about book, brush, bed. You know, you can, as you're reading, don't forget to brush those teeth, and then pop them down to bed, they'll be all cozy and ready to go. Basically what we found was that templating everything was really important. So having, the linked messaging, what the education was going to be, how it was going to be documented easily, and then linked to the billing was super important. And then we do have some people in our clinic who have the medical assistants apply the varnish, but most of us, the doctors, actually do it because we figure we're doing the oral exam anyway. Super easy to get them in that comfy, straddling the parent, laying back onto your lap and being able to see everything and pop that varnish on in about 2 seconds. So it's really easy. And the parent, it helps model to the parents both how it would be easy to brush, different positions, how to lift the lip. And it's basically just showing them how easy and fast it is and making them less intimidated to brush their kids' teeth. So.
And just to add in, I know at our practice, we do have our medical assistants do the varnish, and they do it just before the vaccines. They tie it all together, and it works very smoothly.
Yeah, and you could do it a number of different ways, and it works great.
Well, and tell me a little bit, can you go into a bit of the financial impact on your practice of adding extra service?
Yeah, we were a little bit intimidated and thinking, oh my gosh, are we going to lose money on this extra work that we do as well? Like we always seem to do. But the varnish itself costs about $1.50 per varnish pack. And in our impact on our clinic was that we earned over $80,000 just last year during COVID. So we feel like that's potentially a couple of medical assistants or a nurse, staff that you're funding with this important work, and you're keeping kids healthy.
Yeah, it's pretty impactful, amazing in many ways. Well, thank you both for sharing all this information. I was just hoping that, Beth, you can kind of leave us with some little messages. Have you seen like the benefits you've seen to the families, to the practice? Just what has this done for your practice, making these changes?
Well, I think one thing I didn't realize was how many parents were, I think, afraid to tell me they didn't have a dentist, and felt a little bit, I don't know, bad that they hadn't thought about that. And so I think it just makes it so normalized in what we do on every visit that they're really able to ask for help now if they need a dentist. I think we're also linked better to dentists because we've done that work of trying to find like who are our local resources, who can we call if we have a really difficult situation and we really need them to help us. I feel like we are seeing maybe some less severe caries. I feel like we're getting people to pay attention to it so early instead of seeing that scary bottle mouth at 2. You're like, oh, I'm not seeing that anymore. And I think the other thing we were surprised with, the parents often said that they'd never had the education before about how cavities happen and how sugar impacts that, and just the simple messaging in that 2-minute flip book. And I don't know if they just never got it at the dentist or growing up they never got it, but the parents appreciated it because they're like, oh, I didn't know that. So that made me feel good, like it's not wasting their time.
Yeah, it does make a big difference. Well, I appreciate you talking, Beth and Madlen. Thank you both for talking to me today. All of the information we reference is on the Washington Chapter AAP website, including the mouth management book that Beth was just mentioning. It has a lot of good information for families. The webpage also has a lot of resources for physicians and for families, and including the information on the Mouth Matters training, billing, and this webinar, as well as other webinars will be there. So thank you both for joining me today.